to Short and Sweet, a Donut Princess podcast, going live here from my room as we are unable to meet in person. But Daniel is somebody who I went to college with, and we've had many great fun times together. And it just so happens that he is in the COVID ICU in Boston. So do you mind introducing yourself and telling us a little bit about, who you are and what you're currently doing now?
Of course. Hey, Maylee and friends. So my name is Dan. I'm currently a third-year resident at Brigham and Women's Hospital as an anesthesiology resident. So I'm basically kind of in the midst and a pretty active player in terms of managing patients with COVID at my hospital. And I've been in Boston for 3 years now, which is kind of crazy. I'm just waiting to get back to LA. Back with Maylee.
Did you ever all this is kind of random, right? When you go to med school, you do your residency, is that right?
Mm-hmm. Mm-hmm.
And so how were the first 3 years of med school residency in comparison to these past few weeks?
Yeah, so, my training, I guess it started with college with you, right? And then 4 years of medical school. I did that at Albert Einstein in New York. And then I moved out to Boston for residency, and I've been doing residency for 3 years out of 4 total. I'm actually crazy enough to do one more extra year to do fellowship as well. But anyway, to answer your question, I think that, definitely the last month or 2 months or so has been completely, as cliche as it sounds, unprecedented. It's not what we were used to at all. We had to completely restructure our roles, our jobs, even the places that we work, especially as an anesthesia resident, because we're used to working in the ORs, providing anesthesia services for surgeries. And since COVID has kind of taken over all of our time in our facilities, we've canceled all elective cases, and we're only doing truly emergent cases in the OR. So now we don't, hang out in the OR anymore. We basically are running kind of the ICUs and helping treat some of the COVID patients. We've even converted some of the ORs into ICU units. So just for overflow, once all of the rooms are taken up by COVID patients, we're preparing ourselves to actually use the ORs as a ICU unit, which is pretty crazy, I think.
Yeah.
They're already doing that in, Italy and other hospitals as well.
How many floors would you say, or how many hospital beds would you say are now COVID-19 related for the ICU?
Yeah, so we're lucky enough where we had 2 buildings of patient floors. So we've moved everything into that one building. Although now that building is actually, from what I'm hearing, is entirely full.
Wow.
And we're moving some of those patients into the second building. And then once that second building is full, we'll move to the ORs to take care of COVID-19 patients. The real issue is that this virus, it just, once you're intubated and once you need ICU, basically it's once, so the COVID-19 virus attacks your lungs primarily. And so your lungs need help in terms of breathing and making sure you get the oxygen you need to survive. And in order to help that, you need to be placed on a ventilator. And in order to do that, you need to have a breathing tube. And to put a tube through someone's airway is the act of intubation. So an intubated patient is on a ventilator, having their lungs helped by the ventilator.
So their lungs are still working, but this ventilator is helping them breathe since there's an attack on their lungs.
Yeah, it's damaging the lungs to the point where the oxygen isn't really getting through the lungs into the blood to maintain the oxygen you need for life.
Yeah.
And so we're using the ventilator to help that process. basically you keep the lungs inflated as much as possible to kind of help reduce the amount of swelling in the lungs,
Yeah.
and then kind of blow air past it.
Yeah. Can you describe to me the emotions in the hospital, like, and how starkly contrastingly different it has been since you were, first in there versus, now with like COVID happening? Like, what are the emotions in the hospital right now?
Yeah, I mean, initially I think there was a lot of uncertainty because we were, really people were kind of struggling to restructure quickly and mobilize all of the different facilities and healthcare professionals, and then also find them enough, adequate PPE and protection, and making sure that this is a safe process for everyone involved. We're kind of over that initial hump now, although obviously the lack of PPE is something that's ongoing.
Yeah.
But most of us now, it's just kind of the sobering, and there's the sobering realization that it's going to be kind of with us for a long time. That this is something that we're going to be doing for a while. And the way that we operate, the way that we live our lives and work is going to be completely changed for a long time.
Define a long time. Like, what are you thinking? How long are you thinking this is realistically going to be? And I ask because I'm always watching the news and somebody's saying something different. I would like to hear from a medical professional like yourself on what you guys think, because you guys are literally on ground zero, with these patients.
Yeah, it's tough to say. I wish I had a crystal ball to tell you exactly when this is all going to be over. The way I see it is that it won't be over until we have herd immunity.
Mm-hmm.
And with that being said, with what that means is either enough people get it and have fought it to the point where they can't really get it again, or we've developed a good vaccine for it. And vaccines take at least a year, if not more, to create an effective vaccine. The issue is that the virus also tends to mutate, just the way that the flu vaccine is given every year, but we still have flu outbreaks. And herd immunity is, I'm not sure exactly when that's going to happen, especially because we're limiting the amount of people getting it through social distancing, etc. But with all that said, I think in terms of the virus being with us, it's with us. It's whether and it's just going to be a thing that's going to mutate and continue to be with us, and hopefully we have a vaccine soon. In terms of quarantining and social distancing, we're I would say at least for another month or two of solid social distancing, just because we don't really have an effective treatment yet until that point, and we don't want to overburden our medical systems.
Yeah. Thank you for sharing that.
Yeah.
When you say that the COVID-19 virus will mutate, would it be that, say that we get a vaccine and then it's treated and then a different form can come back where that vaccine no longer works for it? Is that correct?
Yeah, exactly. Okay. And basically the vaccination company or vaccine companies readjust the vaccine every year, so that we can continue to continue to maintain herd immunity as much as possible. But it's something that's going to be with us, unfortunately, as we move forward.
Is that happening right now in China? Because I've been hearing about the virus mutates and changes. Is that kind of what's happening there? Like, what's your take on, like, obviously, in Wuhan, the outbreak started there, and then there was a time where it's like, it's virus free, and now they're noticing that, there's people are bringing it back in again. Like, what's your take on that? What's your opinion on that?
Yeah, there's probably a couple things going on there. One is that people who test positive for COVID and then go to the hospital or and then recover and go home. and then test negative thereafter, the treatments that they're getting in the hospital may be lowering their viral load to a point where it's no longer detectable by the tests. But then they go home and then they still have a low number of viruses, and then their immune system is no longer, again, able to suppress it. And then the viral load increases to the point where it is now detectable again. So it's not like that person was ever truly like cured, but their viral load was just not able to be detected by the test. And then unfortunately they kind of they got sick again by the same virus. And then the other thing that potentially can be happening is that the virus is actually mutating and there are different strains. And usually with viruses, if you are truly, you get it and then you're truly cured from it, it's harder for other strains, even if there are different strains, to reinfect you. It may be that the case is that even if our bodies are able to fight off one strain of the COVID virus, we're not able to do so for the other strains. And that would be a little bit more alarming. But most of the times, I'm guessing it's probably the first case.
Yeah, got it. Thank you. And so, I mean, one of the reasons why I brought you on as a guest is just because, I do like to hear about the experiences of what people are actually going through on the front lines. And, I've had so much now learning so much about hospitals and things that they've been doing to restructure and retrain because of my Lunchboxes for Love concept, which is basically collecting donations and using that money to make gourmet sandwiches, donuts and coffee and delivering them. I just actually got back from a delivery in Linwood to St. Francis Medical Center, and we dropped off some donuts for their night crew.
Haley, I think I lost you. I can't hear you anymore.
Oh, you can't hear me? Can you hear me now? Hello?
Yep, I can hear you, but I can't see you.
Okay. I'm going to end it, and then I'll just join back in.
Okay.
Okay, cool.
Oh, you're back.
Is it better now?
You're back, yeah.
Okay, we'll just carry on. Okay, so what I was saying was, I just came back from a delivery in Linwood at St. Francis Medical Center, and it's great that I'm hitting up all the different hospitals, but what I now want to focus on are the hospitals that aren't receiving that much love and that much attention, mostly in areas that are not so great. So going to St. Francis, I had a customer he had been following my whole journey with DK's Donuts since 2013. So he was there when the half croissant, half donut craze was there, and he reached out to me and he said, hey, I work at St. Francis. We're in a COVID-19 positive unit. Is there any way you could come by? And of course, I went and did that. And so I just was wondering, you're in Boston. Have you also been receiving food donations?
So not officially yet, but I think two of my ICU fellows actually organized something. It's called Dinners for Doctors, I believe.
Okay.
And it's a similar concept. It's it's donation based, and they're creating like a supply chain and a distribution process for connecting restaurants such as like DK's Donuts.
Yeah.
To the COVID ICU. So I think as of yesterday,
Mm-hmm.
they're starting to give 2 meals, both lunch and dinner, for all of the ICU units, which is awesome, which is amazing. Yeah, I mean, I can't thank you enough for establishing your own process and an initiative, because I can't even tell you how much it really helps. Just throughout the day, if just the simple thing like getting a meal, or getting a time to enjoy a meal in the midst of the COVID outbreak is really it's humanizing, and it's really nice. It's a really nice time to yourself, and it's a time when we can all come together as a team to just break bread and feel like a normal person again. So it's awesome that you're doing that.
Yeah, and that was kind of my whole idea when I was thinking about the concept. It's like, in a lot of restaurants, we have like family meal where everybody comes together and, like you said, breaks bread together. And I just like, I always centered around this like moment of happiness, right? Like, what makes you happier more than food? Okay, food is kind of like my realm. Okay, cool. And my friend Monica and I, we put everything together really quickly. Like in less than like 3 days, we put together everything. And immediately, like people started donating, and we started getting corporate sponsors and individuals who are also inspired, just as a way to create that for you guys. Like you guys are on the front lines risking your lives every day at the thought that you guys could catch it, and putting all those hours in. And so thank you from all of us, for doing what you do. I know like you didn't really go into it thinking you were going to be in the COVID ICU. You
Yeah.
were going to be an anesthesiologist, but it's really incredible how many people are just stepping up. I mean, I have friends who also work in the hospitals in LA, and I have one RN friend, and she's like, yeah, like most of these staff members get 3 hours of training, and then it's like, bam, you got to get in there. And it's crazy. Even like the VA hospital, they are retraining their nurses on how to do certain things. And I mean, there's just a lot of stepping up. So it's like the least that we can do for you guys.
That's really sweet of you.
Yeah.
I mean, yeah, just to reiterate your point, shout out to all of the nurses out there, seriously, because they have really stepped up. And like you said, there are nurses that are coming from all walks of life in terms of the hospital, from the PACU, from the endoscopy suite, from like places where like they would not ever want to find themselves in the ICU, are actually being trained and being sent to the ICU just because the lack of resources and the lack of staffing. And there's actually a lot at least my hospital, they're hiring a lot of traveling nurses as well, who are coming from all over. And that work environment is really, really unique. It's actually really nice to see that. All of us were in it together. We're there for one purpose. And it doesn't matter where you're from, who you are, what your previous experiences are, or even your skill sets are. We're all, pitching in to try to make this work.
And so how do all the protests, how do you feel about all of that that's happening nationwide?
I actually, it's actually really funny. I was just watching Trevor Noah's show and his little segment on the protesters, and I had a pretty good laugh about it. I mean, I know I really shouldn't be laughing, just because I think that it's really unfortunate that people are protesting and getting together and kind of doing the thing that we don't want people to do.
I remember hearing the news,
especially from
I thought it was just in San Clemente because that's what the news was. But watching the news last night, I was like, across the nation, like what?
Yeah.
What are you guys doing out there?
It's a little ridiculous, and they're like screaming and spraying all of their their saliva at each other. It's literally the exact thing that you don't want people to be doing. It's really unfortunate from a healthcare standpoint. From a political and economical standpoint, I'm not really sure what those implications are, but from my perspective, it's really sad.
I talked to a nurse today, and she said, I haven't seen my kids in a month. So please guys, like stay home, stop protesting. It just doesn't make any sense. Are you quarantining from, your significant other, Heidi, and your family?
Unfortunately, unfortunately we're not. We're just kind of, doing the best that we can. Heidi and I still live together. Walter's here as well. I haven't seen my family though, my parents in a long time, and I probably won't be seeing them for a while. My sister had an opportunity to go back she's actually in med school now, to back home, and we all decided as a family to have her actually just stay out there in Detroit by herself, unfortunately, and not see her parents. just because just the risk of her transferring over to my parents is high. And my dad has, risk factors.
Yes.
He has hypertension. He's a pre-diabetic. So with all things considered, yeah, we're quarantining in that sense. We're trying to protect our parents who have, risk factors. As far as what I'm doing, I'm pretty neurotic and a little paranoid. So I actually take showers at the hospital before coming home, and I change out all of my clothes. I even actually started to use hospital grade soap on my face and hands and everything like that. Yeah, absolutely. And I started actually taking some supplements like vitamin C and D are known to be beneficial for your immunity. Black elderberry also has naturally, occurring zinc, and zinc is antiviral as well. Zinc is a little hard because you just don't want to overdo it. That's why I'm just taking the elderberry, which is kind of more naturally occurring as well. But I'm just doing all the things, in order to protect my family as much as possible.
Yeah, those are great tips. I mean, for me too, like I'm out doing deliveries and going to hospitals and stuff like that too. So that's great information for those of you who are listening of what to do. I had actually been trying to look for zinc for weeks. And
Yeah,
finally, I just randomly was there and I saw the zinc. I was like, oh, I need it. But yeah, I need to get some black elderberry as well. Because if you're an essential worker, you're still putting yourself out there. You're still outside. You're not staying at home. And it is still very risky for, any of us to go out too. So,
Yeah.
but do you think that you feel any like resentment or sadness because you can't go and see your family, or that you have to take all these extra steps to kind of make sure?
It definitely adds another layer of stress for sure. I would never say resentment. This is what I do. This is why I went to the healthcare industry. And Heidi and I were joking the other day because like Heidi's work from home actually because she's in the tech industry. And basically both of our lives really didn't change because she's work from home. She's always been work from home. I still go to work every day. So in that sense, it hasn't changed that much. But yeah, definitely like it's stressful thinking about your family. It would just be terrible if I brought it home and Heidi were to get sick, or I went to go visit my family and one of them were to get sick. We had to actually postpone our wedding as well because it's not worth it. It's just not. Yeah.
It's not, especially when you're trying to keep it away from that demographic, but at the same time, like life doesn't stop. But I'm sure worldwide it's okay to move an event. There are a few things that got canceled for me too, like this documentary that was made about our whole family. It actually won an award at South by Southwest, and we were all set to go, and then they canceled it, but we did end up still winning an award.
Oh wow.
There are
That's
other
awesome.
like speaking engagements too that I was supposed to speak in front of my high school, and then also at this museum at USC, the USC Pacific Asian Museum, and that also got canceled too. So I mean, it's okay because these things can always get rescheduled later on, and it's good to know that you can reschedule it. But if people's lives are in danger, that's just something that we don't want to risk, especially the older demographic. Okay, so I'm gonna get to kind of like my podcast is also very like informative, but also like touches upon what's happening. So, what are some tips that you can give for essential workers to protect themselves at this time, besides wearing masks, gloves, and hand washing? Is there anything else? Any other tips that you suggest?
Yeah, I guess like tips for essential workers, just to protect yourself. I think just overall is just be smart and thoughtful. The virus is transmitted primarily by touch and droplets from like a sneeze or a cough. And we know that with some of these studies out there that the virus can, last on a surface for an extended period of time. I think it's like 24 hours on cardboard, and then even up to like 3 days on like some metals and things like that.
Like stainless steel.
Yeah. So there's an extended period of time where it can last. So I think that just making sure that you are wiping and those kind of surfaces, those high touch surfaces like doorknobs, buttons, keyboards, um, and then washing your hands before and after you do something, and especially like your own essential workers handling food,
Yeah.
in boxes. And then I know that a lot of people wear masks, and I think that's really important as well, just for protecting others, but also protecting yourself.
What do masks actually do for you? And what's some advice for some of us who are reusing our masks? Because obviously there's a huge shortage.
Yeah. So the concept of behind a mask is really the droplets that are produced when you're talking, or it's sneezing or coughing.
Mm-hmm.
So just keeping all of that contained, and not getting into the air or getting onto another surface. So that's important for that, just as a barrier.
Yeah.
And not all masks are the same, obviously. Like a cloth mask, it does not equal an actual surgical mask, um, even though the CDC recommended that at some point. And yeah, for those who are reusing masks, it's really, you just have to be very careful in terms of getting them on and off.
Yeah.
The inside of the mask obviously is contaminated with your own saliva. The outside of it is potentially can be contaminated with, something that you touched. I think that, readjust, like where you get into trouble is when you touch something or a surface and you readjust the mask.
Yeah.
Because it's pretty cumbersome. That's how you can kind of spread it onto that surface.
Mm-hmm.
So just basically taking off the mask, or putting it back on without touching those sides.
Mm-hmm.
Unfortunately, there's not much you can do to sanitize it. I mean, I guess you could potentially wipe it down.
Yeah.
But I just wouldn't recommend smelling Clorox for the next for however long you wear it.
Yeah.
Ideally you would have to just replace the mask every time you use it.
Yeah.
But I know it's tough because there's a shortage of masks, and it's harder for even you guys to get masks, considering it's all being diverted to the hospitals
Yeah.
now.
Yeah. No,
And then gloves can be tricky also, because it protects us from getting things onto our hands, but the glove itself can be a vehicle, right? As you touch other surfaces. And then I feel like when I have gloves on, I'm like a little less thoughtful about it, because
Yeah.
I'm like, all right, I'm protected, but that doesn't mean that I'm protecting the things that I'm touching. And if you're reusing gloves, you can actually clean the gloves too. You can wash your hands with the gloves on, just as if you're washing your hands, and that should be enough to get the soap and water should be enough to get the virus off of the gloves.
Oh, got it. That's a really good tip that I never thought of. We've
Yeah.
just been I'll use it during delivery, and I'll just like carefully put it and throw it away.
Yeah.
But that's a really good thing to learn, especially if you're going through gloves so often. Soap and water definitely will kill it as well. So that's
depending on the type of glove, obviously, but like rubber gloves or the nitrile gloves that people are using, you can definitely wash your hands with it.
Oh, okay.
Or even put Purell on top of it.
There's a shortage of Purell too. So.
I know.
So yeah, I have another question. What particles need to be transferred in order for someone to be infected? Is it just through the droplets of a sneeze or a cough, or touching through the face? Does it go through the eyes? Like, how does that actually transfer into the lungs?
Yeah, I mean, so all you need is the virus, right? The virus is a thing that needs to be transferred from one person to the other. And the virus itself can be found in your saliva, your snot. And actually, there are some other stories showing that it's even in your feces as well.
Wow.
So it's just kind of, once you have it, it's kind of just spewing out of you. And the way that it travels is, if you're talking and a bit of saliva gets onto a surface, that's virus in that saliva on that surface, and then someone might touch that surface. And then if they were to rub their eyes or touch their nose or eat something, with that hand, That's how that virus can get into that next person. So it's just all about all those particles essentially. So
Yeah.
again, just like wiping things down, being conscious of where your hands have been, and really not trying to like touch your face, or eat food without washing your hands before.
Yeah. Got it. I have a friend whose uncle is in the ICU COVID in Alhambra, and he was
Mhm.
looking for plasma donors and actually found five, but the hospital wasn't accepting them at this time. What does a patient or patient's family do in a scenario like this?
Yeah, I mean that's a big problem, and I don't know. I mean, I guess it's naive. I mean, it's premature for me to call it a problem because we don't know if convalescent plasma therapy is actually effective or not. But it is a therapy that's been proposed.
Yeah.
Um, so, unfortunately, at this point, oops, sorry, that was my camera.
Okay.
Uh, at this point, the both the the institution or a provider at an institution, um, and the patient have to agree to the convalescent plasma therapy, and initiate that through. I think the Mayo Clinic has a good initiative. Let me see here. Basically, you can go through like uscovidplasma.org.
Or like the Red Cross, I think they were going through them to collect.
Red Cross also. So there are a couple institutions, Red Cross being one of them, Mayo Clinic being another, that kind of can help facilitate the process of getting an institution geared, towards participating in the use of convalescent plasma. So yeah, you said your friend's uncle or your
Yeah,
uncle?
my friend's uncle.
Your friend's uncle. Yeah, I mean their family just has to kind of push for it, with
Yeah.
providers, and to see if they would be willing to set up their center as one of the centers providing that sort of therapy. Unfortunately, there's obviously kind of a lot of red tape within healthcare,
Yeah,
um,
as I'm
in terms of
learning.
just making sure everyone's on board, making sure that this is the right thing for patients. We just don't know. Unfortunately, there's not very good evidence for any of the therapies that we're using, but we're kind of using them, just to see and just to try to help as much as possible.
Yeah. Well,
It's not the
describe.
best. It's not the best way to actually go through it, but
Okay.
it is what it is.
Can you just, because I'm not really in the medical field, like describe what this plasma therapy could actually do? Like, what is happening with this plasma donation?
Yeah. So for any of these therapies, really the idea is to try to lower the viral load, right, that someone has, the number of viruses within your body that's, delivering harm to that body. So convalescent plasma is basically what they do is they take blood, from you, they spin it down, and they just take the plasma portion of the blood, and then you get your red cells back. Um, and the plasma portion of the blood has antibodies, which is produced when you fight off an infection.
Mhm.
So if someone was able to fight off the infection, they've made antibodies against COVID-19, and then those antibodies is just it's like the weaponry for your immune system. It's the weapon and the ammo, it uses to kill off the COVID-19 virus. So the idea is if you can get the antibodies from one patient, who successfully fought it off, and give it to another patient who's having trouble fighting it off, then you can help boost that person's immune system to the point where we can lower the viral load, and hopefully they can clear it.
Yeah. And you don't think this is the best way to fight it, and why?
No, I'm not saying that it's not a bad way to fight it. It is one way to fight it. I just don't know how effective it is,
Okay.
just because it's just never been proven so far.
Right.
Um, there are preliminary studies. I just can't endorse anything without knowing the hard facts. It is just one way to do it, and it's just and the science behind it really is really like fine. It might help you for a little bit of time, but I'm not sure for how long these effects of the convalescent plasma is gonna take effect. And also there are side effects. You know, by giving someone else like a part of someone else's blood, you can have reactions to it, allergic reactions that you can have, further lung damage actually related to it. So that it doesn't come without its consequences, although those risks are relatively low. And the blood bank and these companies try to do a good job in terms of making sure that it's viable and compatible with your own blood, just the way that you can't give someone else. You can only give certain people certain types of blood depending on your blood type. It's the same kind of idea.
Yeah. In a perfect world, what would testing and treating COVID look like to you?
Testing and treating COVID?
Treating COVID.
Perfect world. I mean, ideally, we would have all the tests available so that we can test someone effectively. We would have a perfect test, not one that produces a lot of false negatives or false positives, like the ones that we have currently. So really a mass ability to test everyone, know exactly who has it, so that we can, have a system of alerting the people around them, their families, et cetera, that this person has had, a positive test. Although this goes in line with what we're talking about, why the people are protesting in terms of our freedoms and our privacy. But unfortunately, that would be, that would really be the thing that helps our society the best. And then treatment-wise, just a treatment, really like something that kills this virus. We just don't have one yet. We have treatments that have been used for other viruses, but not for COVID itself specifically. And we're trying all kinds of things. And ideally, we would try to find people who have COVID, but are kind of minimally sick, but not very sick yet, and try to prevent them from getting really, really sick, because we're having trouble treating them once they're already too sick.
Yeah, but in a perfect world, that's DK's perfect way to do it. So let's get on it and get it.
Yeah, I know, right? I mean, there are companies that are doing it. Abbott is trying to develop a test that can result in the matter of minutes. Moderna, Johnson & Johnson and Pfizer and Moderna are the American companies that are trying to spearhead the vaccine. There are a couple other, therapies that are being used. I don't know about any therapies that are being produced for COVID specifically, but yeah. I mean, I don't know. Either way, we're getting there. We're trying to figure it out. I think that you just have to hold on to the good pieces of information. Like New York's cases have been, going downward now. I mean, they're still up, but they've been trending. It's not increasing per day anymore, which is nice to hear.
I think at this point, I heard it was like 30,000 have died in the United States. So
it might be more. I think it's 40,000.
More now?
Yeah.
Yeah, it's 40,000 now. And it's just, we don't want to see any more people die around the world. A lot of the questions that my friends ask me, it's like, do you know somebody personally who has had COVID? And, the closest person to me would be my old roommate's uncle, which we talked about earlier with the plasma. We definitely don't want to hear stories about people knowing each other personally. For now, it's just in the media of like a number, and it's so sad. And so, we really want to thank, our healthcare heroes like yourself. Is there anything else you want to share with the public? Like, for example, some things that the media isn't telling us, or even your favorite government conspiracy around COVID-19?
Conspiracy. I don't really have crazy insider information. I see patients, and I care for patients, and I try my best in terms of getting them off the ventilators and things like that. I know some people think that this is man-made or something like that, or that it was born in a laboratory. I really can't say much to that. Just gotta take it one day at a time in terms of just helping people get through this, because it's really the saddest part of it all is that once you have it and once you're in the hospital for it, you can't even have family members visit you. And once you're intubated, it's completely isolating. It's, once you're intubated, the likelihood of you getting extubated is, one, it's low, meaning that you're off of the ventilators, is low. But and even if you do get off the ventilators, the average time that you're on the ventilator is about 10 to 14 days. So basically up to 2 weeks or even longer, you're, in an induced coma. You're, have this breathing tube through your airway. You're in a ventilator. You're struggling for your life. And it's really sad. It's really sad meeting someone and then talking to them, and getting their consent for all of these procedures that we're about to do, and then being the last person that person speaks to. I always tell my patients to just call their loved ones right now before we start all of this, because it may be the last time that they ever talk to them again, which is really sad.
It's super sad.
But yeah, I mean, either way, we're taking things at one thing at a time. So, really, in terms of things to say to you guys, it's really just stay safe out there, be smart. It's not worth it at the end of the day. I know there are economic implications, and businesses and people are really struggling, and it's hitting, the lower socioeconomic classes even harder, right? Because as all natural disasters do. But just try to hang in there, and hopefully we can pull through it together.
Yeah. Thank you so much, DK, for taking time from your day.
Yeah, of course.
I know you work either all night or all day, so just know that no matter where we are in the world, I think we all feel the same. We just have so much respect for these healthcare workers like yourself who are stepping it up, taking on new roles, being in the chaos of all of it. So
it's really not just us, though. It's all the essential workers as well. People like yourself and people like, the ones who are working in the grocery stores and providing us food. Those people come into the hospital sick too. So, people who are putting themselves out there for the sake of others, and it's not just healthcare workers. I feel like, everyone is a hero.
Thank you, DK. And thank you guys so much for listening. You're listening to Short and Sweet, a Donut Princess podcast. I will continue to make episodes that I think are relevant to you, that will add value to your life. And so thank you for listening, and holla at your girl.